The earliest documented use of masks by doctors in the 17th century, the Spanish flu pandemic in 1918, common people were mandated to wear gauze face masks. Non-compliance led to sometimes jail time. There was a controversy on mask wearing even then. The controversy continues today.
So these are some of the observations that dentists across the country have been noticing over the period of last 9 months since the pandemic began. They're looking at how the mask wearing by lots of people is affecting the oral health during this pandemic. So there's an mounting evidence now from the dental professionals are seeing several manifestation of these conditions in their patients, and some of the solutions that the dentists are recommending to overcome this. So if we look at the existing research on what is the effect of masks, whether they act as a protective measure against the spread of disease, these are some of the studies that have come out since the pandemic began, and some of these studies also have looked at the efficacy of these masks, different types of masks on the spread of the disease or filtration of the microbes. And we'll go look at one by one of what these studies are showing. If you look at the oral health and how it affects the different body systems.
If you look at the whole body, we're not going to just study the nose or the eyes or the legs or the teeth. We study all the components. So when we look at the issue of oral health, we're going to look at all the components. The research we're about to share with you is frankly hot off the press. We've been working on this for about 3 years with a number of collaborators at Harvard University, at BU. We've gone through tens of thousands of individual scientific papers where typically people like to cherry pick. What we've done in this research is to organize it, and what you're seeing here is for the first time the circuit diagram in terms of the interactions of all these components.